Learning more about the inflammatory syndrome that strikes kids after a COVID-19 infection. So Texas researchers found that the syndrome severely damages some children's hearts. As KXAN investigator Arezow Doost explains, some parents whose children have been diagnosed say they worry about lifelong complications.
And I monitor her and I check her at least 3 times a day.
Michelle Jones is checking her daughter's blood pressure and oxygen.
She's still having a hard time breathing and is still really tired and very just not herself.
Michelle says Adeline Shedd was diagnosed with multisystem inflammatory syndrome in children, or MISC, in May. We first talked to the mom from Georgetown last month about the mystery illness. She says after her 16-year-old spent more than 2 weeks at Dell Children's Medical Center, she thought Adeline was getting better when she got home. But just recently, she had to rush her back to Dell Children's.
She's just fatigued, or she's very sick to her stomach, or she's, having panic attacks because of her heart.
The CDC says the illness is linked to COVID-19 and can cause inflammation to different body parts. What worries researchers now is the impact to the heart.
When they do ultrasounds, they have found that their hearts are not functioning to their full capacity.
Dr. Alvaro Moreira with UT Health San Antonio studied close to 700 MISC cases from around the world reported between January to July. The confirmed cases included newborns to 18-year-olds. He says what the research team found is that damage to the heart is so severe that some children will need lifelong monitoring.
Many of these children will be treated in an intensive care unit with a multidisciplinary team. Some of them will require medications to help their heart pump more efficiently.
The review, which was just published in a clinical journal, shows MISC hitting healthy kids without warning 3 to 4 weeks after the coronavirus infection. The Texas Department of State Health Services now updates the number of confirmed cases online. So far, there are 22 MISC cases across the state, 8 in Central Texas. The state says about 2/3 of the cases have been in Hispanic children, and nearly 60% are boys. Will Adeline need lifelong monitoring of her heart?
It's possible. Worst case scenario, she's looking at possibly getting a heart monitor and having to wear that 24/7, and possibly even getting a pacemaker put in.
Michelle says the recovery has been tough for her daughter. She also worries about psychological effects and neurological symptoms, including impact to her brain. Arezow Doost, KXAN investigates.
Well, the research team says African American or Afro-Caribbean children made up about 35% of cases. Another finding from the case studies was that almost half of the patients who had MISC had an underlying medical condition, and of those, half were obese or overweight. Now, researchers say that the inflammation found in kids diagnosed with MISC is greater than even Kawasaki disease and toxic shock syndrome, which the illness mimics. Now, they say therapies commonly used for these pediatric conditions are showing signs of working.